The information shared on Light Body Radio is for educational and informational purposes only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician, licensed healthcare provider, or qualified wellness practitioner with any questions you may have regarding a medical condition or health goal. Dr. Laura May, her guests, and affiliates do not claim to cure, prevent, or treat any condition and are not responsible for any actions taken based on the information shared in this podcast. By listening to this podcast, you acknowledge that you are responsible for your own health decisions and that any actions you take based on the content are at your own discretion and risk. Thank you for tuning in to Light Body Radio.
Welcome to Light Body Radio, where science meets soul and healing gets multidimensional. I am your host, Dr. Laura May, functional medicine pharmacist, master intuitive Reiki channel, and certified life and health coach. Here we decode root causes, transmute stuck energy, and empower your full spectrum healing journey, body, mind, and light body. This isn't just wellness, it's awakening, grounded in science, guided by spirit, and designed for your evolution. Let's rise and radiate. Welcome to the next level of you. Hello and welcome to Light Body Radio. I'm your host, Dr. Laura May, and today we have with us Eve Hall, and she is the host of an award-winning podcast called Please Me. It's a bilingual podcast that destigmatizes and normalizes conversation about sex, sexuality, and sexual health. Again, she is the host. She's a licensed physical therapist and intimacy coach, and she's also an ASN magazine columnist and keynote speaker. Her show explores the many facets of human sexuality through empowering solo episodes and bold, insightful guest interviews. So welcome. I feel like we'll go through the rest of your bio as we talk and have you tell your story. So hi, how are you?
Hi, great. Thank you for having me on the show.
Yeah, so tell us a little bit about your story and how you came to be passionate about bringing more destigmatization to both men and women's health issues.
Absolutely. So I am a licensed physical therapist, and I have been treating physical therapy clients for over 25 years. It seems unbelievable to say that, but it's true. And about 8 years ago, I got divorced and went on my own sort of sexual exploration journey. And I became very interested in sexual health conditions, and I specialized in those conditions and became an expert in the pelvic floor. So my practice is called Inspire Health Physical Therapy and Wellness, and I specialize in the pelvic floor and sexual health conditions. I like to say sexual health conditions because I think it sounds sexier than the pelvic floor, which sounds very clinical. And a lot of times people are like, what is that? I don't even understand what that is or where that is in my body, because nobody really talks about their pelvic floor, So sexual health, I think, is more relatable. And I treat conditions like erectile dysfunction, its female equivalent, which is decreased vaginal sensitivity and dryness, things like incontinence, which is an unsexy condition, but does affect our sexual health, and things like painful sex and premature ejaculation, to name a few. And so during my time treating patients with things like erectile dysfunction, etc., I would have clients come to me or patients come to me and say, I am here for this condition. However, my wife doesn't know I'm here, or my husband doesn't know I'm here. And I saw that there was a lack of communication, even in very long-term committed relationships, about sexual health and their sexuality in general. And I found a real need for opening up these conversations and destigmatizing these conversations and normalizing these conversations, because This sex is how we all got here, right? And if we're not talking about something so essential, we are really missing the boat in terms of expanding our pleasure.
Yeah, so much of what you said is so true. And since you already mentioned one thing that people don't really understand, let's start there. Can you explain what the pelvic floor is and why it's so important?
Absolutely. So the pelvis is composed of many different muscles, and they make up a complex called the pelvic floor. And the pelvic floor holds up our organs like the bladder and our reproductive organs, and it protects them. And just like any other muscle in the body, it can atrophy. The vagina is also a muscular um, an anatomical part on our body, as is the penis, right? The penis has muscles in it as well, and they can atrophy, they can weaken when not used over time. And so you can start developing things like prolapse when your pelvic floor is weak, or things like incontinence when you don't have enough hormones and your pelvic floor is weak. So there's a lot of different things that can affect that area. And so strengthening those things in physical therapy is something that I do.
Beautiful. I mean, I know throughout my yoga teacher training and all the classes, yoga classes I've taken over the years, we do talk about pelvic floor in that respect. But I think if, you're not a yogi and like yoga is not in your realm at all, then yeah, I think the pelvic floor can still be sort of that mystery of, well, what is that and why should I care? And I think too, it's worth mentioning that a lot of what you, mentioned just in that little explanation, I think a lot of women think about, well, if I've had kids, I need to worry about that. But if I haven't had kids, then do I need to worry about that stuff? And actually, the answer is yes. Because even if you have had some sort of gynecological surgery, maybe for, cancer removal or something like that, then those issues can be, they can become a problem.
Absolutely. There's a lot of conditions like cancer, like you mentioned. If a person has a hysterectomy or they have any kind of pelvic surgery, this can cause issues in the pelvic floor. And this is not just for women in menopause, right? This is younger women that are experiencing these particular surgeries or conditions like cancer. And if you've had radiation and chemotherapy, oftentimes that will throw you into early menopause, which can also cause issues in your pelvic floor. And, the smooth muscles in your body are not something that are easy to strengthen. So the pelvic floor is made up of both like muscles that you can sort of control, right? And then muscles that you can't really control, like your heart. Your heart is always beating, right? You don't have to really do anything to it because it's just naturally beating. That is a smooth muscle and it's working all the time and stay strong because it has the pump to be alive. But in order to strengthen your heart, you can walk, you can run, you can exercise. So those are ways that you can strengthen the heart. But the pelvis, if you're not strengthening those muscles, they will weaken over time. So absolutely, if you've had a child or if you haven't, you can have problems with your pelvic floor as you get older. And then also hormonal imbalances also can cause, problems with the tissue in the pelvic area, because the tissue is dependent on things like estrogen for the tissue to be strong. And so if you don't have enough estrogen, that's also going to weaken that area as well. So there's several things that go into having a really strong pelvic floor and a strong vaginal cavity, etc.
Yes, which leads to a happy, healthy sex life. Even if it's just solo, it's still important because we know now, or maybe not completely, but we're starting to learn more about how important orgasming is and sexual pleasure is to mental health and mental health satisfaction and happiness. So let's talk a little bit about the orgasm gap. What is that?
So the orgasm gap is a phenomenon where in heterosexual relationships, men have more orgasms than women. And this goes across the board from everything from hookups to marriage and every other relationship in between. And there's a lot of reasons why the orgasm gap exists. But one of those reasons is that when we are looking at sex from a standpoint of an outsider looking at like a television show or a movie or even porn, oftentimes male pleasure is the focus of the sexual experience that you are watching, and penetrative sex is what's emphasized. And that is not how women orgasm necessarily. That is how men orgasm. So only 3 to 5% of women can orgasm from penetration alone. And the number can go up if you include penetration and external clitoral stimulation, then that number can go up. But if you're talking about penetration by itself, only 3 to 5% of women can orgasm from penetration alone. So if what we're learning from the movies, from porn, from, you know, all of the experiences that we're having in the media is a focus on male pleasure, we're missing out on female pleasure. And so it's really about learning, educating yourself so that you can be empowered to seek the pleasure that you deserve.
Mm-hmm. And so how are we going to do that?
By having these conversations. I think that every show that I'm on, every show that I record for Please Me is really trying to close the orgasm gap one conversation at a time by really teaching people and empowering them that they deserve pleasure, that it's not okay for the man to orgasm, roll over, and go to bed.
Right.
You know, and it's okay to ask for what works for you. It's okay to say, I want this toy to join us in the bedroom. It's okay to say, I want you to touch me this way so that I can get there.
Yeah. And yeah, I think there's so much built into, especially Western culture. I don't want to speak for all culture across the planet because I definitely don't know. But in Western culture, you know, like you said, it's just not, that conversation is not there. I think there's a lot wrapped up into how we're raised within the context of religion. And, you know, we're still at that point where we're, you know, demystifying and sort of redefining women's roles, men and women's roles together, and what that looks like. And if it could be something, you know, that's not traditional. And I think it takes some curiosity and bravery for couples to also define that for themselves. Like, what does this look like for us? Like, how are we going to be the happiest together, you know, or, you know, bringing in extra partners or toys or whatever.
Absolutely. I like to consider sex as an adult's playground, and really sky is the limit. There's just so many different possibilities. And so whatever you're into, whatever, be it a kink or just something outside of the box that you know, have never told your partner about, there is room for exploration, and people should be open to having these conversations with their partner so that they can experience the mind-blowing sex that we all want in our lives. And you mentioned society and you mentioned religion, right? And these are all part of sort of our patriarchal system. And so it makes sense that male pleasure in a patriarchal system is going to be at the forefront. But if we understand what these systems are, we can sort of take a step back and say, this is no longer serving me. Let me throw that idea out the window and let me develop what I think works for me and my situation and my partnership.
Yeah, and I love the way you said it too, because notice how we're not shaming or, you know, like being overtly negative about that patriarchal system. It's just about awareness, and again, bringing awareness to where we are so that we have that empowerment and that decision making autonomy to change it if we want to. If it's not working for us, let's, you know, we have the power to change it, and we should be able to do that. moving forward with, again, like compassion and love and acceptance and open-mindedness, all that good stuff.
Absolutely. And mindset is so important. You know, if you're only focusing on the negativity of patriarchy, you can really like just go down a spiral of negativity in life in general, right? So
Sure. Yeah,
thinking about things in a positive light, understanding that we are part of systems and what systems do serve us and what systems don't serve us. And we can make the choice. We are individuals, and we have freedom to make the choice for ourselves. So learning is so key to this piece of the puzzle in order to really get our needs met.
Mm-hmm. I mean, and we talked a little bit about the emphasis or the influence, I will say, on hormones and um, the changes that women go through. And or I think, like these hormone fluctuations can happen actually really early for some
Mhm.
women too. And I think that's also not talked about. So this doesn't have to be just a conversation about menopause or perimenopause, but I think so a lot of women, even in their, 30s at least, and maybe even the 20s, I don't know, start to experience hormone fluctuations. And well, and especially if they're, postpartum, there's definitely hormone fluctuations there. And that can contribute to vaginal dryness, which can then sort of lead to this, no, sex isn't comfortable, I don't want to. And it's one of those things to where like if you don't use it, then you do lose it. Is that true with like the urge and like the want or the will to engage in sex also?
I think so. I definitely think so. I feel like when you do have great sex, you want more great sex. So I definitely
Mhm.
think that's part of it. But also, the hormones can cause you to have decreased libido. So if you're
Mhm.
having decreased hormones, you might also be experiencing decreased libido. And so getting your hormones in optimal balance is really important. And so I want to emphasize the difference between optimal balance and normal balance, right? So somebody say in their 50s is normally without hormone replacement is going to have low hormones, low estrogen, low progesterone, maybe even low testosterone, and DHEA. But if you are able to supplement those hormones and get them into an optimal level, you're going to feel much differently. You're going to have less brain fog. You're going to have more energy. You're going to have a stronger pelvic floor, because the pelvic floor and the tissue surrounding the pelvic floor, the opening of the vaginal opening, the urethra, which is the opening that goes from your bladder out of your body, needs estrogen
Mhm.
in order to have healthy tissue. So if you don't have healthy tissue, you're going to naturally just have things like incontinence without even having had children. So it's really important to have optimal hormone balance in your body, not
Mhm.
just normal hormone balance. And oftentimes you'll go to the gynecologist and say, hey, I'm having these issues. And they're like, oh, well, it's normal for you to have low hormones. Just go home and deal with it. And that's not okay. We need to
No.
really, educate ourselves so that we can have optimal health throughout our entire lives and really enjoy sex until, our 90s and beyond, right? I mean, why
Yeah.
not? Our bodies were built for pleasure, and we should be experiencing pleasure throughout our whole lives. And I love that you brought up self pleasure before, and I think that if it's so important to keep the relationship that you have with yourself, even when you are in a coupled relationship, there's a difference between your relationship with yourself and your relationship with a couple or your partner. And just because you're in a relationship with someone doesn't mean that you have to stop masturbating. And it is something that can really help with your mental state. It does release all of these great feel good chemicals in our bodies that can really boost our mood, help decrease depression, help, us feel better, help with sleep. So there's a lot of great benefits. And you also mentioned, that these decreases in hormones can happen in their 30s. And a lot of women do experience in their 30s, a decrease in hormones, and they start their perimenopause journey earlier than many doctors even realize. And I know that I experienced this myself, and I'll just say that I had hip pain that followed me for many, many years, to the point where I ended up going to an orthopedic surgeon and had surgery on my hip. And when they went in there, they said, "Oh, your hip looks fine. The joint is fine. The cartilage is fine. There's nothing wrong with your hip." So why was I experiencing severe pain in my hip for 7, 8, 9 years? It's because my hormones were depleted and diminishing over time, and it was causing more and more joint pain. And so I ended up, because I was not diagnosed properly, having an unnecessary surgery to my hip. And, a lot of other people experience similar things in different ways. But for me, I thought that was a pretty extreme example of something that could happen to somebody, and I am very conscious about my health. So I take care of myself, and I went to the doctor. I spoke to them about it multiple times, and this is what it led me to. So I love talking about this because I think it's so important for women to understand that optimal hormone health is important for our overall health.
Oh, for sure. I mean, and I don't even think, even like, you're aware of it because of what you do. I'm aware of it because what I do. But I mean, unless you're just out there listening to episodes and podcasts or doing your research and reading literature about female hormone health, then a lot of people have no idea that those creaky knees can be because of low estrogen. That frozen shoulder is most likely due to low estrogen. And so a lot of what we see is definitely a manifestation of these hormones that are out of whack, whether it's low estrogen, low testosterone, low progesterone, and low DHEA. And like you said, figuring out what that optimum balance is for you, because my normal, quote up, normal optimal numbers are not going to be the same as yours. And definitely finding a practitioner that understands this and is willing to travel this journey with you and help you figure out what that equation looks like for you. And it may or may not be an OBGYN. There are a lot of OBGYNs out there that these days, unfortunately, that don't even know how to prescribe hormones. So it could be a urologist. It could be a longevity practitioner, a functional medicine practitioner. So if you have a practitioner that has told you that this is normal and you're just going to have to live with it, please run the other way and start doing your own research about finding a practitioner that can help you and that can be your guiding light and help you restore this stuff, because it is so intertwined and so necessary for quality of life. I mean, that's really what we're talking about here. We use words like happiness and we talk about endorphins, but it's about quality of life, and women deserve to have a high quality of life as long as they can as well. I mean, how many relationships end because the happiness with the sexual interaction is just not there. So this could also save relationships and save marriages too.
100%. 100%. And I myself was in a relationship where 5 of the 8 years were sexless. And so I knew that once I exited that relationship, that would never be the case for me again, because it was very important for me. I was a very sexual person, and I was never going to give that up again for any reason whatsoever. And so that was sort of like the beginning of my journey to, finding my, big clit energy.
Oh, I love that. So since you brought that up, let's talk about that. And then I do also want to take it in a little different direction, but let's talk about that first. What is
Sure.
that?
Yeah, absolutely. So when I was researching for my show about the female equivalent of big dick energy, right, which is the confidence that you have in your sexuality, I couldn't find anything. They said that women could also have big dick energy, and I just thought that was ridiculous. We have our own body parts, and we have the clitoris, which is the female equivalent of the man's penis. But what's different about the clitoris is that it is an organ specifically designed just for pleasure. It has no other purpose in the body. It doesn't have reproductive purposes. Its purpose is pleasure. And so I thought that that would be a good way to explain the confidence that a woman can have in her sexuality. And so I coined the term big clit energy to represent the confidence a woman has in her sexuality, a person who is, having wonderful sex, having mind-blowing sex, and that confidence in the bedroom translates to all areas of our lives. It translates to the conversations that you have, the boardroom meetings that you have to speak in front of, whatever that may be, it translates to all areas of our lives. And so I really encourage women to hone that confidence because it is a really powerful thing.
I can't really second that answer any more than, yeah, for sure. Again, because I think it comes down to fulfillment. And when you're fulfilled, you show up different in life. And yeah, so that permeates to everything in your life. And so where do I want to go? So let's talk actually about the prevalence of erectile dysfunction, because sexual dysfunction definitely, I think, women might be known more for their sexual dysfunction because of this lack of orgasming, and this only that 3 to 5% that can gain pleasure from the penetrative sex. But there's definitely, I think, the numbers of erectile dysfunction are probably increasing, if my understanding is correct. Is that true?
So they do increase over time. So it's interesting because 20% of men will have erectile dysfunction of some form in their 20s. And it goes up 10% per decade. So 30% in their 30s, 40% in their 40s, 50% in their 50s, and so on. And so, yes, it increases over time. It's very common. And unfortunately, it's not talked about. So a lot of men suffer in silence for many, many years with low function because they're too ashamed to bring it up to their doctors or even talk to their partners about it. So it's important to have these conversations because it really is treatment for erectile dysfunction. There's a treatment that I do in my practice called acoustic wave therapy that helps to break up blockages in the tissue so that it can increase blood flow. And it also creates more capillary formation in the tissue over time. So you're not just breaking up blockages, but you're also creating more blood vessels that can bring more blood to the area. So it's a very effective treatment. It really is the gold standard in treatment for erectile dysfunction, and it's non-invasive. And unfortunately, the pills that doctors give you oftentimes can cause side effects. And some of those side effects can be a heart attack. So it's not something that's, not serious. It can be a very serious side effect. So thinking about more non-invasive treatments, especially if you're early on in having issues, is important. And people understanding that there are treatments available so that they can get those treatments early on. Because unfortunately, a lot of people just wait until they're so far gone that it's going to take them a really long time to have any effect with the treatments. Whereas if they're getting treatments in the mild or moderate stages, instead of waiting till it's severe, they're going to have much better effect with the treatments. And then the female equivalent of that is decreased vaginal sensitivity and dryness. And that is also caused by lack of blood flow. So again, that's another treatment that I do in my practice. It's also the same treatment, but it's just a slightly different part of the machine that you use. And it does increase blood flow and break up blockages in the blood vessels so that women can also experience more blood flow. And when you don't have enough blood flow, you start having decreased sensitivity, which can happen, say, in a diabetic foot, right? If a diabetic foot doesn't have a lot of blood flow, it's going to be numb. And so the same thing can happen in the vagina and in the penis as well. If you're not having enough blood flow, you're going to have decreased sensitivity. And we want to keep that area sensitive.
Well, and even a lot of the medications that a doctor or practitioner might put you on for other mental health challenges can oftentimes dull that libido or that drive to have sex. And so that can compound. If you're already having an issue, it can compound it. It can lead to an issue that you didn't have before. There's plenty of other medications out there, both for cardiac health, for cholesterol. I mean, there's so many meds out there that can actually affect your libido. And again, I don't think this is something that practitioners tell their patients when they write a prescription. They might brush over some of the more common side effects, but I don't really see that conversation leading towards, oh, this is how it's going to affect your sex life. Which again, super important. So number one, important to be aware of, but number two, like you said, like get at this approach, this treatment, this sort of riding the ship, this optimization as early as possible. And I'll say this for females too, like don't wait until you're in full blown menopause, which is amenorrheic, to seek out hormone replacement therapy. Hormone replacement therapy is safe. It is effective. The WHI study was super flawed, and it put the fear of God into an entire generation of medical practitioners, which has really done a disservice to women, not only for this topic, but just their health in general. Like there's so many implications to this that I'm not going to go down that whole rabbit hole, but but it's important to know that it is safe and it is effective. And the sooner you start to optimize and rebalance, the sooner your body not only will sort of start to do those things that it naturally wants to do anyway, but it'll prevent you from going to that complete exhaustive state within your body. And that's what we want to prevent. We want to help your body maintain those, optimal levels as long as possible, so that hopefully you don't get to the point of complete sexual exhaustion or hormonal exhaustion or, complete lack of function.
Absolutely. And just to bring myself into the equation as an example, when I started hormone replacement therapy, I mentioned my hip pain before and having had surgery on my hip. And after the surgery, the pain was exactly as it was before the surgery. There was no effect whatsoever, except for I had opened up my joint for no reason whatsoever. So after the surgery, I had the same pain, and it wasn't until I went on hormone replacement therapy, and within the first, I would say, month, 70% of my pain was gone. So, and I had experienced that pain for many, many years. And so it's so important to look at your hormones, even in the perimenopause state. And you're absolutely right. The hormone fluctuations happen very early. And I got that same, message from my doctor. Oh, well, you're not in menopause yet. You're still getting your period. So you don't need to worry about hormone replacement therapy yet. And that was untrue. And so oftentimes you have to really do your research and know that many doctors are not trained in the areas of hormones. And you would expect that they would be, because they are gynecologists and you think that the pelvis is their wheelhouse, right? But, a lot of times their training has to do with, giving birth and not necessarily in the later stages of a woman's life. So pick your doctors well. And if you don't get the answers that you want, keep searching.
Yes. And it boggles my mind really. I was listening to Peter Attia's show, The Drive, and he had a urologist on, and they were talking about, it's a whole episode, you guys, it's great, of female hormone balance and hormone replacement. And, what's funny to me is that our practitioners, our doctors, can prescribe birth control all day long. And that's hormone replacement therapy. But when it comes to actually, optimizing for a later stage in life, they're completely in the woods and in the dark and it's like deer in the headlights, like they don't know what to do. And you'll get this with endocrinologists too. And you would think endocrinology, well, that's your entire hormone system of your entire body. But practitioners are taught to specialize. And so when they do that, that's really what they do. And they don't study any of these other things, and they're not taught any of these other things. So I do have compassion for them, but I also, like you, have been on the receiving end of that, being told of, oh, like, it's just something you have to get used to, or, oh, this number is fine, even though you're symptomatic. So even if, this is the other thing too, even if your numbers, quote unquote, look fine, that means they're within a reference range. That does not mean they're optimized for you. If you're having symptoms, then you deserve to get treated. And so it's important to, again, just keep looking. There are great practitioners out there. So don't lose hope, please.
I love the fact that you bring up your labs, right? And oftentimes doctors will say, oh, let's review your labs. And they'll say, everything looks great. Everything's within range. And, they don't give you the paper to look at. Ask them for the copy of your lab report and look at all of the results, because you may be on the low end of normal, but that may be too low for you. Or you may be a couple of, numbers below normal, and they'll say, oh, well, that's close enough, it's fine. No, it's not necessarily fine. So really advocating for your own health is so important.
It is so important. So I feel like we might have touched on this before when we talked about the orgasm gap, but what is the orgasm revolution?
So the orgasm revolution is a movement that I started to bring awareness to the orgasm gap. And basically what it is a it's posting on social media that you are aware of what the orgasm gap is, and you have joined the revolution by buying a t-shirt that I sell that says orgasm equality on it, and posting yourself in that t-shirt and saying, I have joined the orgasm revolution, and this is what it's about. It's about bringing awareness to the orgasm gap. And the more awareness that we spread socially on any of our networks, the more people will really understand what it is, so that they can close their own orgasm gap and have more awareness. So that is what the orgasm revolution is. And I invite your listeners to join the orgasm gap. You can find that t-shirt on pleaseme.online, which is my website.
Beautiful, beautiful. Well, is there anything else? We haven't really talked about your intimacy coaching. Let's dive into that a little bit so people can sort of, again, just have another tool in their toolbox, something to research if they're interested. And really, I'd like to know, and I think the audience would like to know, like, is this the same as couples therapy, or is it different?
So it is different. Coaching and therapy is different because there is just different, different schooling involved, right? And so therapy, is often done by a social worker or a psychologist, and they have training to work on your history, your past. And coaching is sort of more about the now and the future, how you want to build your life from this point on, and how you want to improve your life from this point on. So I do coaching for couples and singles to help them with their intimacy. And oftentimes, I'll have a couple that maybe has an issue like a discrepancy in their sexual desire, so sexual desire discrepancy, and how they can sort of help themselves to sort of get on a more even playing field in terms of everybody getting their pleasure needs met. And so sometimes I'll meet with couples for that. Sometimes it's a very personal thing with one person, an individual who is seeking help for one reason or another in terms of their sexuality. And so the coaching is really not about dealing with past trauma. It's really dealing with like the here and now, and how you want to build on your life now and improve your intimacy with yourself or with a partner.
Yeah, I love that. And I think too, I sort of went into this with another guest the other day when we were talking about the difference between therapy and coaching. And again, I'm not knocking therapy. Therapy's great. I have a therapist and I also have a coach. And so, like, the difference that I see is that within coaching of any kind, usually it's more action oriented. So you are talking about the here and now. You're not rehashing old stuff, but you're coming up with a plan with your coach to move forward. And your coach is really sort of, I feel like, a person that helps like reinforce and maybe rebuild that empowerment in your life.
And holds you accountable. So it's like an
Oh, yes.
and holds you accountable. It's an accountability buddy that you, set goals with, and then talk to them about how you're reaching those goals.
Yeah, for sure. Well, let's see. Is there anything else that we need to bring light to before we wrap up for the day?
We've covered quite a lot, I have to say.
I know. It's been great.
It has been.
Yeah. Okay. Well, if there is nothing else, tell everyone where they can find you. You mentioned your website, but please say it again to make sure that they can hear you. And we'll put it in the show notes too.
Absolutely. So my show is called Please Me, and my website is pleaseme.online. The show has really become a multimedia company where I now do speaking engagements. So I'm available for that. I'm available for coaching sessions. Even if you don't live in the state of Florida, because I do in-person therapy for people that obviously live near me, right? But even if you don't live in the state of Florida, you can still get coaching by me, about sexual health issues, because I have protocols for every condition, and I can share those protocols with people. So even if they live somewhere else and they want to get treatment for erectile dysfunction, even though I can't do the acoustic wave therapy on them myself, I can direct them to do that with a practitioner near them, but I can share the whole protocol, the other things that I do to help people with that condition. So that's another option as well.
Beautiful. I love that. All right, everyone. So definitely check it out. Pleaseme.online. I said that correctly.
Yes. And I am actually up for a couple of different awards right now, two of which are the ASN awards. One is for Best Educator. The other one is for Best Educator website. So please check out my website. It is a plethora of information. I have a really great sex toy store on there, and all sorts of really fun things, products that I use myself, etc. So check it out.
Beautiful. Well, again, everybody, this has been Eve Hall, and her website is pleaseme.online. So go check it out. And until next time, be good and be safe and have fun.
Yes.
Thank you for joining me on Light Body Radio, where functional medicine meets intuitive healing and transformation happens on every level. If this episode resonated with you, please like, share, and if you're ready to go deeper, visit drlaramay.com to book a functional medicine consultation or an intuitive healing session. Whether you need to rebalance your body, clear your energetic blocks, or reconnect with your soul's purpose, I've got you. You can also follow me on Instagram or TikTok at Dr. Lara May for daily inspiration, energy updates, and healing tools. Remember, your healing is multidimensional, and so are you. Until next time, honor your body, trust your intuition, and activate your light.